Good morning, everybody, and welcome to The Balancing Act. I'm Julie Moran.
And I'm Olga Villaverdi. Today, we're focusing on your health.
That's right. Today, we begin a four-part series on improving healthcare with a look at a very important resource you might not have thought about before, your pharmacist. Plus, it's an immune disease of the thyroid that affects mostly women, especially those under 40. We'll be shedding some light on Graves' disease today.
Lots to get to. The Balancing Act starts
right now. This morning, we begin a four-part series on improving health care for you and your family with a look at a very important resource you might not have thought about before, your pharmacist. Having the right pharmacist as part of your healthcare team is essential. And here to explain is Dr. Roger Accardi from Good Neighbor Pharmacy, which operates a network of more than 3,000 locally owned community pharmacies. Welcome, Roger.
Hi, nice to meet you, Julie.
You know, what are some of the benefits of using a locally owned and operated pharmacy?
Well, one of the first things I think you might experience as a patient in an independent pharmacy, in contrast to the traditional box store pharmacy, if you will,
right,
is the absence of apathy. Your comfort zone will be expanded almost immediately. You are valued as an individual. They will learn your name, they'll remember your name, and you'll remember his or hers. And so the interplay between you and the practitioner, the pharmacist, is enhanced, and it's a freer exchange of information. And subsequently, he's in a better place or she's in a better place to give you appropriate information about your medications.
It's that feel-good feeling of knowing somebody you're talking to. What are some of the important things to look for in a pharmacist?
That accessibility I think it is important with any healthcare practitioner that's part of your team that you feel comfortable, that you don't feel necessarily guarded, and you don't feel as if you're simply a number. What I see with Good Neighbor Pharmacies is that's not the case.
Yeah.
Traditional pharmacy practices, the whole program is predicated on the prescription itself. In the independent pharmacy, that's not necessarily the case. Rather, being prescription-oriented, they are patient-focused. So you become the center of the practice, not the piece of paper in your hand.
Yeah, sometimes you don't feel that way when you go in. And I would imagine that's important not just for prescriptions, but for over-the-counter medications as well. You could talk to them about it.
Yeah, indeed. The over-the-counter medications, if put into the prescription department at a stronger dose, become prescription drugs. The same medication as in the case of, say, ibuprofen. So the interplay, the integration of what those over-the-counter items that you're using may in fact influence the outcomes with the medicines you're using now.
What other additional services do you offer?
We do what's called disease state management, where we don't assume the role exclusively of being a vendor of drugs, but rather a purveyor of information. Now, you could have 3 prescriptions written by your physician, and they all read twice a day. In the chain practice, oftentimes, that's how it's written. 1 tablet twice a day, 1 tablet twice a day, 1 tablet twice a day. However, they may differ in outcomes unless they are specified specifically when to take it. Do you take it with food, without food? Do you take it before meals? You take it several hours before the meals, several hours before bedtime? How, in fact, do you use those medications? Every drug poses a risk-benefit ratio. The intent of this interplay is to reduce that risk, is to improve the batting average of those medications so you're as safe, you and your family, as then can possibly be.
You know, when you think about it, you see your pharmacist so much more than you see your doctor. Why wouldn't you want to have that great relationship?
Excellent point. Because I think in many cases, the perception of the pharmacist is that he's unattainable.
Right.
That
he's in the back, I can't talk to him.
He's insulated behind X number of walls, and maybe you see the top of his head. In the independent practice, you don't see that. They promote intimacy, so the pharmacist, proximity-wise, is going to get closer to you. You're the focus of my practice, then you stand above everything. And there are times, in fact, that we will contact your physician and maybe suggest that that prescription not be filled. Because the key piece, the target, is to maximize and optimize your quality of life.
Thank you so much for stopping by. Great information and great having you here today.
Sure. Remember one thing, it's not necessarily just the prescription itself being correct. It's the information around that prescription that really will define its outcome.
Good point, Roger. All right, and if you'd like more information, we want you to log on to thebalancingact.com. You can also follow us on Facebook and Twitter. As always, we love hearing from you.
It's called Graves' disease, a condition affecting 8 times as many women as men. Now, while treatments continue to improve and progress combating this autoimmune thyroid disorder is being made, Graves remains a difficult to diagnose disease. With us to shed light and insight on this important medical topic is Dr. Mark Lupo, medical director at the Thyroid and Endocrine Center of Florida. And coming up a little bit later, we're going to meet a mother whose 14-year-old daughter's early signs of Graves remained a mystery until an accurate diagnosis was revealed. Good morning, doctor.
Good morning, Olga. Nice to be here.
Thank you for being here. Let's talk first about Graves' disease. What is it exactly?
So Graves' disease is the most common cause of an overactive thyroid. So before we get into the Graves' disease, we have to remember the thyroid is a butterfly-shaped gland that sits at the base of the neck and creates thyroid hormone, which controls metabolism and energy for all parts of the body. So if your thyroid's not working, you're not working. In the case of Graves' disease, which is the most common cause of hyper or overactive thyroid, the thyroid is making too much thyroid hormone, so everything is sped up. And Graves' disease is often concerning as a name because they think it's a grave prognosis.
And when I first heard it, I thought to myself, wow, you know, a disease that's grave, but that's not necessarily the truth.
That's not the case. It was named after Sir Robert Graves from 200 years ago who discovered the disease. So the prognosis, luckily, with proper identification of the disease and treatment, is quite good.
Help me understand why it affects such a disproportionate number of women.
Women seem to be more prone to Graves' disease, about 8 to 10 times more so than men. We don't know exactly why, but it has something to do with sex hormone, estrogen, progesterone. And if we look at women who have had pregnancy within 12 months, 30% of people who are diagnosed with Graves' disease have had pregnancy within the last 12 months. So there's something about pregnancy, the sex hormones, that might stimulate the risk of Graves' disease.
Now, are there specific signs and symptoms that people can look for?
Absolutely. So the signs of Graves' disease are the physical signs. So people have prominent eyes, and that happens in about 40 to 50% of patients.
And speaking of that, we have some images I'd like to share with our viewers. Tell me what we're seeing here. Are these some of the signs here?
Yes, this is not a subtle thyroid eye disease. This is more end stage, where patients have a significant amount of swelling behind the eyeball. So the eyeball gets pushed out in front. So that's called proptosis.
Okay.
And then sometimes the same thing can happen with swelling of the skin. So they can get swelling and redness of the skin in front of the shin, and also some changes in the hands as well. That's not as common, though. It can also cause an increased heart rate or tachycardia, so patients feel an increased awareness of their heart, like it's beating out of their chest sometimes, and that can be quite uncomfortable and one of the first things that causes the patient to go to the doctor for help. Anxiety, short fuse, a lot of mood changes and irritability, insomnia, weight loss, feeling very hot, muscle weakness, where if you're climbing a flight of steps, you feel weaker, exercise intolerance, shortness of breath, things like that.
Now, you mentioned pregnancy. Is there a certain age group that maybe can happen more in, or is that not a factor?
So the pregnancy issue reminds us it's more of a reproductive age woman. So usually women in their 20s and 30s are more prone, but there's not an age cutoff. So this could happen any age, both for men and women, but typically in the 20s and 30s most commonly.
And doctor, are there effective ways to treat this disease?
Absolutely. So we have ways to control the excessive amount of thyroid hormone production.
Okay.
And there's 3 primary ways to treat it. So one is with medications that block the thyroid's ability to make extra thyroid hormone, and that's called medication management. And then the other treatments we call definitive therapy. So definitive means we're doing an irreversible procedure to completely knock the thyroid out. So that's either radiation treatment in the form of radioactive iodine, which is a pill, or surgery to take the whole thyroid out.
I love hearing that there are options. I want you to stay right there, because when we come back, we're going to meet a mother whose 14-year-old daughter was diagnosed with Graves' disease. Her personal story when we come back. Stay tuned. Welcome back, everyone. We're talking about Graves' disease. Once again, we're joined by Dr. Mark Lupo, Medical Director at the Thyroid and Endocrine Center of Florida. And joining me now is Dr. Nicole McDonald, a family physician with the New Boston Village Primary Care located in Fall River, Massachusetts. Welcome.
Thank you.
Thanks for being here. Now, doctor, I know you have a personal story. Your 14-year-old daughter has Graves' disease. Tell me how you found out and what happened.
It started around 6 years old. She started becoming very anxious and irritable, flew off the handle over the smallest of things. Then we noticed her appetite became voracious. She'd be eating 3 breakfasts a day, eating, dinner, lunch, just constantly eating without gaining any weight.
Wow.
Then we live in New England where it's obviously very cold. In the winter, she'd be going outside without a jacket on, running around in her underwear, never feeling the cold.
Okay, so you obviously know something's not right.
Yeah, I said something's not right here. Then I noticed she had a fine tremor and her handwriting was becoming very sloppy. My husband has a tremor, so I figured it was something familial. Finally, one day we were sitting in the kitchen across from each other and she happened to look up, and that's when I noticed she had a goiter, which is an enlarged thyroid, and it all clicked together. So I called her pediatrician. I said, something's not right here with her thyroid. And he goes, oh, kids don't usually get that, but let's just check some blood work. We did the blood work and her thyroid was out of control. At that point, I felt her heart, and her poor little heart was beating out of control.
So she had that tachycardia.
She had the tachycardia.
When you got the diagnosis, I know you're a physician, but were you petrified?
Oh, I was terrified. It's your baby and you don't know what's going on. And as a physician, I didn't know a whole lot about Graves' disease.
You didn't?
No, and wasn't much out there, especially for children with Graves' disease, since it's very rare.
So what happens when it's left undiagnosed? Because we saw images. Is that the scenario?
Some of the images we saw were the extreme scenario of the eye disease that gets really bad and can threaten vision sometimes. People can go blind potentially. The heart can beat so fast that you have high output heart failure, where you go into heart failure, and also you have abnormal heart rhythm problems, particularly atrial fibrillation, which can cause a stroke. So this is a deadly disease left untreated.
So early diagnosis is so key, isn't it,
Absolutely,
doctor?
absolutely.
What treatment is your daughter undergoing right now, and how has she improved?
So she started on medicine to try to suppress the immune system, but with kids, they rarely go into remission. So then we had to decide between the radioactive iodine or the surgery. She wasn't a candidate for the radioactive iodine, so she actually had to have 6.5-hour surgery to have her whole thyroid removed.
My goodness. And doctor?
As we talked about before, we have medication management, but in some cases, especially with kids, the disease is relatively aggressive. And so the medications don't drive things into remission and don't work as well, and there's potential side effects. So going to surgery or radioactive iodine, and for children, our experience with radioactive iodine is more limited, which is why I think in this case they chose surgery. And it's a very difficult surgery at age 8 to do, and you have to have a very experienced surgeon. So for adults, the surgery might last 1, 2, or even up to 6 hours, but the key is, if surgery is chosen, to work with a surgeon that does a lot of thyroid surgery.
I want to end with you. Anything you would tell our viewers out there who maybe don't know about Graves' disease, or maybe they're hearing about a diagnosis today?
Yes, there's an organization that I found that was invaluable. It's the Graves' Disease and Thyroid Foundation, and it's gravesdiseaseandthyroidfoundation.org. As a physician, I didn't have as much knowledge as I should, and the foundation was a world of wealth. So I would definitely encourage anyone to look into that.
Thank you so much.
Thank you so much.
God bless you, and good luck to your daughter, and God bless her. Doctor, thank you so much.
Thank you. Appreciate that.
Really appreciate your time. And if you'd like more information on conditions affecting the thyroid, you can also visit us at thebalancingact.com. We have all the information there for you. Or join in on the discussion by logging on to Facebook/The Balancing Act Fans.
Getting the whole family together for dinner can be a challenge, but it is a very important part of being a family. And imagine how much harder it is when everyone is in the mood for something different. Have no fear, our Everyday Gourmet series has the perfect solution.
What a long day.
Yeah, right?
What does everybody want for dinner? I'm hungry.
Something warm.
Something good.
Something spicy.
Okay.
Dinner time can be one of the best parts of the day, and it doesn't have to be complicated to get everyone together, even when they all crave something different.
I have the perfect solution. How does yakisoba noodles sound to everyone?
Sounds good.
Dad, I have spicy chicken for you. Jessica, how does teriyaki beef sound?
That sounds great.
Wonderful. And Jonathan, sweet and sour chicken?
Sounds awesome.
Sounds good. And I will take the savory soy sauce.
Each yakisoba tray has noodles ready to cook up in the microwave in just a few minutes by just adding water, giving you and your family a warm, delicious meal in minutes. To prepare, just add flavor packet number 1 and then add a cup of water. While they're cooking, ask your family what they would like to mix in. Yakisoba noodles go great with just about anything.
What does everybody want on their bowls? Dad, I can top yours with chopped tomatoes and some leftover chicken and maybe a little extra hot sauce.
Oh, it'd be perfect.
Jessica, what would you like on your beef bowl?
I'll take some tomatoes and garlic powder too.
Sounds great. And Jonathan, what would you like on your sweet and sour chicken?
Nothing. I like it just the way it is.
Okay, sounds perfect. Honey, will you help me chop some tomatoes, please?
For sure, absolutely.
Thank you.
Okay, kids, it's something for everyone on family supper night.
Awesome.
Let's go.
So why not make family supper night a tradition at your house? Even picky eaters love Marachon noodles and yakisoba trays, and Mom loves how convenient and economical they are. Head to Marachon.com or look for Marachon ramen noodles in the soup aisle of your local supermarket. And don't forget to check out our website as well, thebalancingact.com.
We hope you learned a little something on today's show.
Remember, we've got lots more on our website, thebalancingact.com.
Check out our Facebook page. Why not share your thoughts about the show there? We'd love to share them here.
And until next time, remember, find your balance. So long, everybody.
Today's AccuWeather forecast is brought to you by Inbox Fitness. Shop smart, get fit.